Hi, this is Brandon from Richmond Aesthetic Surgery, and today I want to talk about a common issue that people bring up after breast reduction surgery, and that involves wound healing and wound breakdown. So with a breast reduction, we perform what's called an anchor pattern incision, where you'll have an incision around your areola, down the center of the breast, and underneath the breast. Very commonly, patients will have a little bit of wound breakdown at that T-point, and that's the area where that horizontal incision under the breast meets that vertical incision. Where those 2 points connect is the point where blood supply is at its lowest point and tension can be high at that point. Those two factors make the risk of breakdown at that point higher than anywhere else on the incision. We close in multiple layers to aid in the structural integrity of that area, so if you do have breakdown, almost always it's confined just to the skin, and very rarely do we have to do anything surgical to fix it. We will talk to you about wound care, and almost always these wounds will heal perfectly fine with just dressing changes. There are some things to help prevent and aid in preventing and healing these wounds, namely smoking cessation, no vaping, and getting anyone that has diabetes at a nice low A1C level. Those are the biggest things to help prevent and treat these wounds. If you ever are experiencing any wound healing issues, I know this can be sometimes a little bit scary and a little bit anxiety provoking, so always feel free to reach out, call, send us a message, and myself or one of the MAs will get back to you immediately and help address any of your concerns.